Welcome to the video answers for Part 1 question set 6. Let's get started. First question, which drugs are known to cause aplastic anemia? And what's the treatment for aplastic anemia? So for the causes, the main drugs to know for your test are anti-cancer drugs, chloramphenicol, NSAIDs, propylthiouracil, and methimazole. And then for treatment, first you're going to stop the causative agent if you know what it is. Then you're going to replace whatever you're deficient in, things like red blood cells or platelets. You can also give granulocyte colony stimulating factor, GCSF, to raise the white count. And then sometimes bone marrow transplants are required. Next, what physiologically is taking place in decompression sickness? So decompression sickness is one of these high-yield step 1 topics you're not going to find in a lot of review books. But decompression sickness occurs when divers come up too quickly and that gases like nitrogen that have been dissolved in the blood at those high pressures when they're down deep in the ocean begin to come out of solution and they form gas bubbles that can occlude blood vessels. It also goes by the name the bends. Next, a 34-year-old woman develops a painful right eye with decreased visual acuity. Exam demonstrates a firm right eye. What type of glaucoma is this patient experiencing? So an acutely painful eye that's rock hard when you mash on it is most likely going to be acute angle closure glaucoma, also sometimes called narrow angle glaucoma. This is a serious medical emergency, so you definitely need to be able to recognize that classic presentation. The next part of the question says, what's the difference between the mechanism of closed and open angle glaucoma? The angle we're talking about here is the anterior chamber angle, which is the angle between the cornea and the iris where the trabecular meshwork is. So in closed angle glaucoma, the lens and the iris are actually touching so that aqueous humor can't flow from behind the iris into the anterior chamber and then drain through the trabecular meshwork. So the pressure builds up behind the iris and that actually pushes the iris forward so that the angle closes somewhat and that can obstruct the trabecular meshwork. Then in open angle glaucoma, the angle's wide open, but down in the canal of Schlemm where the trabecular meshwork is supposed to be draining, down in the plumbing of the canal of Schlemm, you have these microscopic blockages. And this is more of an insidious chronic problem with gradual vision loss from outside to in, sort of like a tunnel vision. So no pain, no hard eye, no acute vision loss in open angle glaucoma. This is a gradual vision loss, and it's usually seen in elderly patients. So what's the fundoscopic finding associated with glaucoma? You're going to be looking for something called increased cup to disc ratio, or cupping of the optic nerve. Normally the optic nerve is flat, or there's a small pale area called the optic cup. So you have the optic disc, and then inside that you may be able to see this pale optic cup. Now normally the optic cup is at most about 1/3 of the size of the optic disc. If the cup is larger than that, maybe it's half the size of the disc or 2/3 of the size of the disc, then you need to suspect glaucoma and either refer to an ophthalmologist or you do tonometry yourself, which is where you're measuring the intraocular pressure. But on fundoscopic exam, you're going to look for that increased cup to disc ratio. And then what's the treatment for closed and open angle glaucoma? So for closed angle glaucoma, the acute treatment consists of 3 different eye drops: topical beta blocker like timolol, a topical alpha-2 agonist like aproclonidine, and a topical muscarinic agonist like pilocarpine. Then, depending on how that cocktail works, you might need to add oral or IV acetazolamide, which is a carbonic anhydrase inhibitor, which is going to reduce production of aqueous humor. Or you could use IV mannitol, which is an osmotic diuretic that's going to draw fluid out of the eye and back into the blood. And then you can also do a laser iridotomy, which is where you use a laser to create a hole in the iris so that the aqueous humor can drain. So that's closed angle glaucoma. What about open angle glaucoma? So for open angle glaucoma, we usually use topical prostaglandins like latanoprost as the first line treatment. And then topical beta blockers would be second line. And then other treatments would include things like topical alpha-2 agonists, topical acetazolamide eye drops, topical muscarinic agonists, and then there are a couple of different surgical options too. Next, is a 34-year-old schizophrenic patient having active hallucinations not oriented to time, place, or person able to legally agree to a plan of care? Well, the answer to that is no. And then what factors must be in place in order for a patient to have the capacity to make decisions? Well, the patient needs to be able to make and communicate a clear choice. The patient needs to be informed and be able to understand the risks, benefits, and alternatives. The patient's decision must be stable over time. The decision is consistent with the patient's stated values and goals. And the decision is not based on hallucinations or delusions. Next, a 32-year-old man is being treated for alcohol dependence with disulfiram. One night, he begins drinking and later has severe nausea and vomiting. What's the mechanism of action of disulfiram? So disulfiram inhibits the enzyme acetaldehyde dehydrogenase. So there are two steps to metabolize ethanol. First, ethanol is metabolized into acetaldehyde by alcohol dehydrogenase. Then the second step, that acetaldehyde is broken down into acetate by this enzyme acetaldehyde dehydrogenase. So when you give disulfiram and you inhibit this enzyme, acetaldehyde can begin to build up. That causes nausea and vomiting, as well as flushing of the skin, sweating, palpitations, low blood pressure, and headache. So why on earth would you want to give somebody a drug that does that? Well, we give disulfiram to recovering alcoholics so that if they fall off the wagon and drink, even just a little bit, it's going to make them sick. So we're kind of conditioning them to think, I get sick when I drink, so I'm not going to drink. And then what other drugs have a disulfiram-like effect? Well, there are actually several other drugs that can cause this disulfiram-like effect, so you need to warn patients taking those drugs not to drink because it's going to make them sick. The drugs we're talking about include metronidazole, certain cephalosporin antibiotics, specifically ceftriaxone and cefotetan, which have a certain side chain that can cause that reaction. There's griseofulvin, which is an antifungal, and also the first-generation sulfonylureas, which are diabetes drugs. But these first-generation drugs are hardly ever used anymore because there are newer, safer drugs that don't cause this side effect. All right, next. In this question, we're given a patient with xeroderma pigmentosum, and the question is asking, what cancers is this child at higher risk of developing? So he's basically at risk for all types of skin cancer. Melanoma, basal cell carcinoma, and a squamous cell carcinoma are going to be the three big ones you're going to worry about. So with xeroderma pigmentosum, there's a defect in nucleotide excision repair, which makes it hard to repair endogenous damages to DNA. Next, the thalamus is a relay station that conducts signals to and from the brain. Which thalamic nuclei are the relay stations for each of the following body sensations or activities? So auditory sensation, it's the medial geniculate nucleus. Visual sensation, it's the lateral geniculate nucleus. Motor to the body is the ventral lateral nucleus. Facial sensation is the ventral posteromedial nuclei. And body sensation is the ventral posterolateral nuclei. Next, what is PPAR gamma and how is it relevant to the treatment of diabetes mellitus? So PPAR gamma is peroxisome proliferator activated receptor gamma, which is a nuclear receptor and a transcription factor that's found in adipose tissue, and it's important in adipocyte differentiation. So it's relevant to treating diabetes because there's a certain class of diabetes medications called the thiazolidine diones, or TZDs, that bind to PPAR gamma, and that is going to improve insulin sensitivity. Next, a 23-year-old man comes to your clinic with a fever of 39 degrees Celsius, that's about 102 Fahrenheit. He also has a headache and myalgias. This is the second fever he's had in the last 2 weeks. He recently finished treatment to eradicate the lice infestation that he acquired during a recent trip to Mexico. What organism might be responsible for this man's recurrent fever? So the organism is called Borrelia recurrentis, which uses lice as a vector. All the other Borrelia species are transmitted by ticks, like Lyme disease. But Borrelia recurrentis causes recurrent fevers because it has the ability to alter the proteins that are expressed on its surface, so it's going to keep generating new immune responses that trigger fever. So the classic symptoms are sudden fever, chills, headache, muscle or joint aches, and nausea. It can also be a rash. And these symptoms continue for 2 to 9 days, then disappear. The cycle can continue for several weeks if untreated, but most patients are going to improve within 24 hours after starting antibiotics. And our last question, a 40-year-old man arrives at your clinic for his first physical in 20 years. He reeks of cigarette smoke, and you notice his jacket bears the logo of his favorite tobacco company. He proudly informs you that he got this great jacket by redeeming all of his cigarette cartons. At what stage of change in overcoming his smoking habit is this man? So stages of behavioral change are extremely important for you to know for step 1. They include stage 1, which is pre-contemplation, which is a stage in where patients don't really recognize that there's a problem. Stage 2, it's contemplation, where now they acknowledge that there's a problem, but they're not really doing anything about it yet. Stage 3 is preparation, where they're getting ready to make a change. Stage 4 is action, where they're executing the change. Stage 5 is maintenance, which is where they've been successful with implementing the change and then now maintaining that new behavior. And hopefully they don't ever get to stage 6, which is relapse, which is where they return to the old behavior. So this smoker in our question is in the pre-contemplation stage. There's no recognition that a change needs to be made at all. He's very proud to be a smoker. So that's it for set number 6. Smoke them if you got them.